John Bluford's distinguished career in hospital and health system administration has spanned more than 4 decades. He's been recognized as one of the most influential people in healthcare and served as chair of the American Hospital Association in 2011. He's also the founder of the Bluford Healthcare Leadership Institute, a professional development program that introduces talented minority undergraduate scholars to healthcare administration, with the expectation that this pipeline of talent will ultimately help to eliminate health disparities among populations dealing with sustained hardship. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hetterly with AHA Communications. In this podcast, hosted by Joy A. Lewis, Senior Vice President of Health Equity Strategies with AHA, Bluford describes how his institute trains promising young talent to assume leadership roles, the impact they've made, and how to deal with pushback in some quarters against DEI efforts in general. This podcast was recorded at the American Hospital Association's annual membership meeting in Washington, D.C.
Good morning, John. Thank you so much for joining me today. Is it fine to call you John?
Please do. Good morning to you.
Because I am sitting with the John Bluford. And this came together rather quickly, so I guess my timing was right. Thank you for carving time out of your busy schedule to join me in conversation today. Today's conversation is a really important one. We want to focus on how might we think about ways to create a diverse talent pool of healthcare leaders. We know how important it is to have a diversity of thought, different perspectives weighing in, making decisions that then lead to better health outcomes for the patients and families and communities that we serve. So currently you are the president, but also the founder of the Bluford Healthcare Leadership Institute, which was established over a decade ago in 2013. And your program trains and mentors and prepares early careerists to advance into leadership roles in healthcare settings. And I guess in addition to how you're spending your time today, we should talk about your tenure, your career portfolio, which includes...
It's been a long one.
I know. Spans over 50 years?
Oh, just about. Not quite over 50, but we're getting there.
Okay. I want to be like you when I grow up. So, former President and CEO, President Emeritus of Truman Medical Centers in Kansas City, Missouri. Prior to that, CEO of Hennepin County Medical Center in Minneapolis, Minnesota. So let's start there. Can you walk our listeners through your journey and I guess leading into this question around what were some of the conditions that you observed, you witnessed inside hospitals and health systems that you led, and also as a former chair of the AHA's Board of Trustees, that led you to create the Bluford Healthcare Leadership Institute?
Hey, thank you very much, Joy. That's a great lead in. And I would start by saying that these 45 plus years in the business have always been in urban settings, large tertiary teaching hospitals that dealt with underserved patient populations. So that has been my story from day one as an epidemiologist for the Center for Disease Control in the ghetto areas of St. Louis, Missouri, Pruitt-Igoe housing project, which was the first federally funded housing project in the country. And that is kind of where my orientation comes from. More recently, as a CEO, and I've been retired for 10 years, but I'll say recently as a CEO of 2 major academic training centers, I discovered that there was not a pipeline of diverse talent coming through graduate school programs for hospital administration. How do I know that? Because I was a preceptor for several programs across the country between the late 80s and 90s, and I consistently got very talented scholars to come to my institution to fulfill their requirements for graduate school, but none of them were diverse candidates because they weren't in the pipeline. And the genesis of the program that's in place right now is a request that I made to the Hennepin County Board of Commissioners to give me some funding to go to Morehouse College and recruit an undergraduate student to come to Minneapolis and work with me for the summer.
Just one?
Just one. Well, you got to start somewhere.
Yeah, right.
And that one student stayed with me for 2 years while I was at Hennepin, followed me to Kansas City, Missouri, and ended up working for me for 17 years. So that project was very successful in one respect, but not a lot of players in it. But secondarily, because of the success of that one student and my love for doing that kind of work and mentoring, I did the same thing when I got to Kansas City, Missouri. And that has led me to go to primarily HBCUs, Fisk University, Spelman College, Morehouse, Florida A&M University, North Carolina A&T, and Hampton University more recently.
Not Howard, my alma mater?
But it will be there next year.
Okay.
And solicit and recruit some very, very, very talented and smart scholars and convince them that healthcare is a good career path for them and go for it. That's one reason for the BHLI. And the other is a wonderful experience that I had in the early 80s as a participant in Harvard University's mid-careerist programs. I was 31 years old at the time. And that experience just exposed me to how the sausage is really made in healthcare. And I wanted to expose these young people to that type of experience. I could go on, but that gives you a little bit of the seeding of the Bluford Healthcare Leadership Institute.
And again, the early beginnings rooted in looking at expanding and providing exposure to those from historically underserved, marginalized communities and giving them an opportunity to even consider healthcare.
Absolutely.
Right. So if anyone visits your website for BHLI, they will see the Institute is described as an intense professional development program. Can you share a little bit more? What does that mean? What does intense mean in this example?
Intense, it's a 2-week program, 7 days a week. Each day our scholars are picked up by an executive van or bus at 7 in the morning, and their day ends 12 hours later. As the last couple of hours of the day, they're working on a case study that they will present to a community audience at the end of the program. So intense, in my view, means first and foremost looking for very serious scholars that want to be successful and hopefully in the healthcare field. The idea is that we are preparing them not for the next level, but the level beyond that. We want leaders, not mid-careerists.
And we know that there's typically this plateauing that occurs when you get to the midpoint. How do you then move into the more executive senior leadership roles?
So we have a very strong didactic experiential curriculum with leaders from the industry all over the country coming in and sharing their stories, their personal stories. People like Mr. Rick Pollack, for example, or Mr. Wright Lassiter, for example. I think we've had 4 past chairman of the boards from the AHA. Mindy Estes comes to mind. Kevin Lofton has been a couple of times. Gene Wood has been. So they'll get experience and wisdom from the top of the industry. That's number one. Number two, not only didactic and experiential learning, but we really focus on executive presence and what people call soft skills. I don't agree with that terminology. I think they are essential skills. And by that I mean presentation skills, language skills, appearance skills, self-awareness skills, how to network skills. We drill that into each and every one of these scholars every day and all day. Even though we do have some social activities, but it's not a frat party. you're still on stage. So we have golfing outings, and we've done bowling before, and we go to the performing arts, and we tour a couple of museums in Kansas City, high end. But we're constantly looking at our scholars and observing our scholars and how they interact with each other and others.
How they show up.
How they show up, good point. And we don't grade on the curve. If we catch something that's out of order, we pull them aside and say, you might want to reconsider how you're doing that.
Mm-hmm. No partial credit, huh?
No partial credit. And I think that's very enlightening for these students.
That's helpful to your point. There's the didactic component, the experiential component, but then there's the how do you read a room?
Exactly. There are two things that I could have mentioned too. Etiquette training, because part of the interview process is often how you perform at dinner or lunch. So we do that. And we have speech coaches come in and really help on the presentation skills. So the underlying theme of that, sometimes it's not how much you know, but how well you can communicate what you know.
That's right. Very comprehensive. I don't know what you do with folks like me who are not morning persons. So 7 a.m.?
They get on board real soon, or they're left behind.
They don't have a choice,
yeah,
right?
That's right.
So a little bit more about, I get the goal here. To your point, it's not mid-careers, it's preparing folks for those senior leadership roles. What's been the impact when you look back over the past decade since the inception of this program? Where have your scholars landed? What have they gone on to do?
I'm glad you asked that question. That's the best question of the interview, because we can talk a lot about what is and what we want to be, but what's the impact is the punchline. And we have been quite successful in our goal. Now remember, the goal is to train culturally sensitive, talented individuals to ultimately impact healthcare disparities among minority and vulnerable patient populations over the next 2 generations.
A tall order.
That's a tall order. We've got time, and it's going to take time to get it done. And in that regard, in round figures, we've had 150 participants come through the program over the past 11 or 12 years. We've had 120 internships that have resulted from those students coming through our program. Now, internships are fully paid summer internships after their 2-week didactic experience in Kansas City. And those internships have been in 50 sites across the country. And the punchline is this: out of 121 students who've actually graduated from undergraduate school, because I interview them as freshmen and sophomores, so they're very young.
And you're doing the interviews?
And I do the interviews personally. Out of the 121 that have graduated, 100 of them are in healthcare space today, 83%. And the others are lawyers and on Wall Street. They're doing well for their own personal careers, but 100 of them are in healthcare. So I'll just give you an example. And this is a 1-hour interview in itself, where some of these students are, and more importantly, what they're doing. And you can project what they're going to be doing in years to come. But we've got one of our scholars who was in our program in 2014. He is now the surgical specialty clinic director at Henry Ford Hospital. We've got another young lady who's just doing a bang-up job. She's the pharmacy infusion manager at Emory Hospital's Winship Cancer Center. And she took me through a tour of this new facility. It is really awesome, and she's in charge.
And she's in charge.
And
she's at the helm.
She's at the helm. And we've got another young lady, I think you're going to meet her at your program in Kansas City later this summer. She's the deputy director for policy and human services for the governor of Kansas. And she's working on access to mental health and Medicaid expansion, which, as you know, is a big issue. So we've got young people, 5, 6, 7 years in their career with no ceiling, doing meaningful and important work with good compensation.
That's critical. And well, you started out with them getting paid internships. I noted that.
Absolutely. And they get paid for their 2-week tenure in Kansas City as well. It's a $2,000 stipend, because we realize while they're there, they could have been working their summer jobs. So we want to be competitive to get the best students. And the best students are being paid for their time right now. Let me tell you a little bit about these sites. I mentioned 120 internships, 50 different sites. The American Hospital Association membership and its leadership has been very valuable connectivity for us because we're placing our students in their institutions. So we've had students at Duke University, Johns Hopkins, Atlantic Health in Morristown, New Jersey, Advocate Atrium have taken a lot of our students. Truman Medical Center is my old stomping ground, obviously. It's taken a lot of students. University Health in Cleveland, several Blue Cross Blue Shield programs across the country. St. Luke's Hospital, Dr. Estes' old place, has taken several of our students. Aon, long-term consultancy,
Right, Aon Hewitt? Okay.
has several of our students. So it just goes to show that networking and the loyalty and concern among my colleagues in the field are paying dividends as well and helping us do this.
Amazing, amazing impact. So when you started this Leadership Institute, again in 2013, the environment was quite different, the external environment. And so what we're looking at right now are some serious, as my CEO, Rick Pollock, likes to call them, motivated adversaries with deep pockets who are waging a war against anything that smells or looks like diversity, equity, inclusion. So again, we're in a very different place today. How are you thinking about the existing world that you're training these young folks to show up in? How are you preparing them to be successful with all the headwinds in the midst of these anti-DEI efforts?
That's a great question, and perhaps one difficult to answer, but it's easy for me. One, we started before these anti-DEI affirmative action related mentality surfaced. And as such, very narrowly focused on teaching, mentoring, coaching, and perhaps more importantly, sponsoring the scholars in our program. And that sponsorship, that coaching, that teaching was very specifically directed toward dealing with healthcare disparities in America, specifically among minorities and underserved patient populations. Rural America, there are different pockets that need the support. And we wanted to make they were culturally sensitive to the issues of social economic determinants, et cetera, which I now favor the public policy determinants of health and be laser focused on that and eliminating the disparities. So we don't talk a lot about DEI or anything. We talk about disparities, socioeconomic determinants, and how you can position yourself to get in a decision-making role to make a difference.
And the disparities have been there. They have a long tail, to your point.
Yes.
Well documented. So keeping a focus on the elimination, not the reduction, the elimination of those disparities.
To zero.
Is
And we hope that we've given them enough time frame over the next 2 generations to make a difference. I certainly don't want my grandson's children to experience some of the same disparities.
Correct. And I like the breakdown. You've done a really good job of distinguishing between mentoring and sponsorship, for example. Those two tend to get conflated, and we know they're very different.
I think many of us who've had the pleasure of serving in this industry were helped quite a bit by someone that was in those positions that we wanted to get to. And it's not unusual for me to pick up the phone and call a colleague of mine and say, you know, Miss Sue Jones Joy Lewis has been in your operation now for 4 years, and I understand she's doing well. We want to see some growth in her career path.
Right.
Yes.
Makes sense. Appreciate that. So we're coming up on time here, but I want to ask, it would be foolish to have someone of your stature sitting here and not solicit some piece of advice from you to these young scholars What is it that you wish someone had told you?
You know what? I've had such a positive journey. And I wish someone would have told me about what an opportunity and blessing it's going to be to help and serve the community in which I work. It's hard work, but the work is twice rewarding when you see the results. That's a very powerful statement. And I tell everyone, at least in my case, never had a job. It's always been a mission, not a job. And that's how I've gone about my work. Compensation and those kinds of things have always been secondary. And I tell people all the time, if you're going in it for the money, then do something differently. But if you go in it and do well, get your money.
That's powerful, John, and very compelling, this notion of you're in it because it's your cause to make lives better at the end of the day. So I can't thank you enough for your continued leadership. You laid the mantle down in terms of CEO-ship roles a decade or so ago, but you continue to add to that almost 50-year legacy and that we referenced earlier. Really impressive and impactful career that you've had and continue to have for many of us who are in the trenches here. So it's great to be in community with you and to have this conversation, and thank you for your time.
Thank you for inviting me.
Absolutely.
Thanks for listening to Advancing Health. Please subscribe and rate us 5 stars on Apple Podcasts, Spotify, or wherever you get your podcasts.